I have personally tested, like with my hands, hundreds of men who were potentially at the highest risk for HIV. And like in the 20 minutes that I ran the test, I got to speak to them. And I learned more from them than I have from any professor that I've ever met around how to do this work because they told me how.
Hey, everybody. Welcome to Duke's Download. I'm your host, James Duke Mason. And today I'm thrilled and honored to welcome Dr. Demetre Daskalakis, an infectious disease physician, longtime gay health activist, and former leader at the CDC. I just have to say right off the bat, perhaps more than any person I've literally ever seen in my whole life, you kind of exemplify and embody the phrase purpose-driven life. And I've always found it incredibly inspiring, when you meet somebody who, I mean, I could drone on. I'll let you speak for yourself. But the first thing that sort of stood out to me, starting with your work as NYC's Deputy Commissioner for Disease Control, and then obviously the work that you've done at the national level, I think the fact that, sort of history lined up with your own life direction, life story. And I found that sort of combination not only so thrilling and exciting, the notion of like, you stepped up at this historic moment, but, I can only imagine just, someone who started getting involved in activism and advocacy young, in a way, how empowering that is to have a sense of purpose in your life. And so anyway, there's so much to discuss, but I just wanted to thank you, first of all, for being here. And
Thanks
I'm
for
greatly
having me. And what
appreciative.
a nice thing to say. So I'm really
It's
excited to
true.
get to talk to you. I appreciate it. Thank you.
It's true. I mean, like I said, you started as an NYC's Deputy Commissioner for Disease Control, then obviously directed the CDC's Division of HIV Prevention, led the National Center for Immunization and Respiratory Diseases, and then helped coordinate the national Mpox response. Um, but I thought we'd start at the beginning. Maybe, I'd be interested, for those who don't know, if you could talk a little bit about your origin story and how you first got involved in activism.
Yeah, I mean, so for me, it started when I was really young as well, actually. So I was undergraduate at Columbia University, and when I moved to New York when I was 17, and really early on in that time, being out as a sort of gay man in New York City, and a young gay man in New York City, like I started to meet people, and then all of a sudden I would not see them again because they were getting sick. And so that was in the early 90s. And so even early on while I was an undergrad, I started doing things to sort of work to teach high school students about safer sex in that era. And then ultimately, like my sort of aha moment, like where I generated that North Star that I've been following ever since, was in my senior year in college when I was working on a large display of the AIDS Memorial Quilt, which, if you don't know what that is a quilt
Mhm.
that people submit panels for people that they've lost to HIV/AIDS. And, it started as a few panels, and now it's like acres and acres and acres of panels that
Right.
represent a lot of lives. And so, I was working with that display. And I just remember standing on College Walk at Columbia on 116th between Broadway and Amsterdam, and just deciding that, what I wanted to do was work to make sure that no one would either get HIV or suffer or die from it. And, that was like the beginning of the origin story of like what became my North Star. And I've got to say that North Star has stayed, but like slightly evolved to really be about infectious diseases in general. But has always had at its core the HIV work, even when I was doing, work in vaccines. So it
Mhm.
started like that. And then, I was going to be a doctor. And so I went through the process of, my schooling. I decided to move up to Boston to do my residency training and my fellowship, and kept on track to do infectious diseases, which is how you had to do HIV medicine at that point. And, I remember there was one moment where I was up there doing lab work, and there was an infection in New York City of a gentleman with HIV with rapid progression of disease. So got really sick really fast
Mhm.
with multi-drug resistance. And they were like, oh, he got his HIV because he was at a bathhouse. having like unprotected sex. And he was actually someone who also was dealing with crystal meth addiction. And so I was like, never mind this lab. Let's go back to like my source and start doing
Right.
work in New York City, where I landed as
Right.
a doctor at Bellevue. And there I was doing, just HIV medicine, but then knocked on the door of the venue where the
Nope.
gentleman acquired his HIV and said, "Hey, I want to come and do HIV testing here." And they said yes. And that is the actual beginning of my career, which is that going from the like doctor in a room taking care of patients to
Right.
like, I can take care of populations,
Right.
potentially doing the work. So I started doing that. Um, Received my master's of public health, supported by a family who donated some money to NYU to make sure that no one would die like their son did of
Mhm.
HIV.
Mhm.
And so that my North Star continues. And then the rest is the story. I, went to HIV in New York City, did a lot of work there, kept getting advanced to be the head of all of infectious diseases at the Department of Health, led a bunch of crazy responses like measles and COVID, went to
Mhm.
CDC, led HIV, got pulled into COVID, then got pulled into Mpox, and then got pulled into immunization and respiratory diseases, all with the North Star of making sure that people don't suffer and die from these things.
Did you know? So you knew, because obviously HIV first became a national crisis in the early '80s. But were you always aware from when you were super young, when you were a kid, that medicine and biology was something that you wanted to do, or were those two things like was it a totally separate notion in your head, or was it always interconnected in some
Yeah,
way?
no, like so HIV was like not a thing when I was a kid because
Right.
I grew up. I mean, it was a thing, but like it was not the reason that I wanted to do medicine. And by kid, I mean when I was 3. So I wanted to do medicine since I was like a little kid, not because of any role models, but just because I I was it was my thing. Like I had like a doctor's kit when I was a kid, and that's like the thing that my favorite toy, and it's played out. It continues to be my favorite toy.
That's incredible. I mean, also the fact, of course, I'm familiar with the AIDS quilt because not only did I start learning and reading about the history of activism, of gay activism at a young age, but I actually later on became friendly and worked with Cleve Jones on a bunch of different advocacy projects over the years. But did you connect? Did you connect with Cleve back then? Did you meet him, or what was it? How did you even begin to get involved with the AIDS quilt? And
Yeah,
uh,
I mean,
really,
so
what are the historic moments too to be
yeah, I mean,
involved?
for me,
You know?
I didn't know Cleve then, but like I definitely, like for me, it was like
Right.
I started at the grassrootsiest grassroots in the history of grassroots. Like I was, going to teach like kids in the Bronx how to use condoms. Like so that's how it really began. Like when I was an undergrad, and then as I sort of did more and more work, I'll say that the AIDS Memorial Quilt and like a benefit that we did that sort of aligned with it, like really introduced me to some of the activists in the city, and then as my career went on, like these people went from like like people that I thought of as activists to being friends. And so I have sort of, had this group of people who like really go back into the roots of like ACT UP all the way into the present era. And so I feel like, that's how I happened upon it. I think it was all about like I wanted to be a doctor, and then like I was a part of a community that was being, really hurt by infectious diseases. And so like those two things, those Venn diagrams overlapped in a way where it all started to make sense.
Why did you touched on it already, but that point about prevention specifically, obviously in areas where HIV prevention in areas where you know there is a potential higher risk in terms of uh, sex clubs, bathhouses, night, those sorts of establishments. Why, other than the fact that there obviously is a disproportionate potential, exposure to not just HIV but STIs, TB, all sorts of different things. But why did you decide that that was an area that you really wanted to focus on, and what was that experience like? Like, how successful did you feel your efforts were, and what was that whole experience like? And you were in a place like New York City too.
Yeah, great question. And I think the answer is that one of the things that you learn in HIV is that you have to let people living with HIV be the ones that guide you to what you need to do, because they're like ultimately like the folks that I think are, the most important in that calculus in terms of figuring out what to do. So for me, sort of hearing that, that one case, that one person acquired HIV in that space made me think this is a good place to go. And I'll tell you that, it's influenced my entire career in a way that's like, I think good to like kind of good to think about, which is, I know a lot of people that do a lot of work in HIV, right? And I feel like one of the things that sort of like set me apart was that I wasn't just writing the grants to get people the money to be able to go into the venues to do the work. So I mean, I did eventually write the grants to get the money to get the people to do the work, but at first it was me with like HIV tests in my backpack and a couple of other people who I had like convinced to volunteer to go in there to do it. And so for me, like this idea of community wasn't one that was very abstract. It like actually was like right in front of me. And what I learned is that, people, the barriers that people have to being able to sort of get what they need from the system revolve around the system's ability to create barriers that further stigmatize them. So like I feel like, I have personally tested like with my hands hundreds of men who are potentially at the highest risk for HIV. And like in the 20 minutes that I ran the test, I got to speak to them. And I learned more from them than I have from any professor that I've ever met around how to do this work because they told me how and like what the issues were. And so like I really sort of think that for me, it was less about the venue. I mean, ultimately, like, I took that venue idea and like then like what I learned there became like the framework for how we're doing HIV prevention in the country. Right. So that's a big deal. But like it's like learning from the people that are affected by the infection and then using that learning to design how you like work to make it better for them is the way to go. And that's why the venues were interesting to me then. And like even more, that's why I'm grateful I was in them.
Well, no, absolutely. You can learn in a venue like that. You can learn a lot in a sort of condensed environment, if that makes sense. So that there's a lot, there's a lot to work with in terms of knowledge and practical experience. What was that like to go from working in an environment like New York City, where obviously, like I said, you were at the forefront of disease prevention there, but to then sort of scale that to the national level and going to work at the CDC? Obviously, we're in a very different environment now when it comes to CDC than we were even 3 or 4 years ago. But was that an environment that you felt um, comfortable in, I guess is the right word? Did you feel like to make that sort of, even though you were working for the biggest city in America, what was that jump like to go from that environment to working at a place like the CDC that had obviously also going back to the AIDS epidemic or the onset of it, the CDC and the gay community always had kind of a complicated relationship.
Yeah. So a couple things. So I think first, I'm a very big skeptic of government. And so
Mhm.
one of the best ways to address your skepticism of government is to serve in government. And so for me, it was a great opportunity to sort of, having been like a person in a city that was highly impacted by HIV, who then became like the person who got to sort of influence like how the city responded to HIV and infectious diseases. And seeing sort of like what we needed more from the federal government that we weren't getting, like what like frameworks that we needed from them that we weren't getting, sort of getting to bump up that level to try to figure out how to make it better was really exciting. Now, do I always walk in the room and like I'm totally confident that I'm going to take over like a $1 billion organization and it's going to be just fine based on the fact that I like ran infectious disease in the city? Hell no, right? Like when you start, you're like, oh my God, this is like this giant fire hose I'm drinking from. I barely know what you're talking about. Like CDC is like, as an example, like a huge glob of acronyms. And like they were like talking things that I was like, I do not know what you're talking about. But like the only way to do things is to do them. And so like I think that there's a lot of like learning that you can get, lots of background, lots of experience, but at the end of the day, like the way that you learn how to be the division director for HIV prevention in the US is by doing it. And so like definitely I feel like that anxiety goes away after you like realize that the skills that you learned, running COVID, running measles in New York City when there were big outbreaks aren't that different than the skills that you need nationally. I think are good. But then also I learned so much stuff that I never knew I would learn by doing it. And so,
But what
yeah,
a time. I love that. I mean, not I love, but like, I can only imagine what an unbelievable 4 or 5 years that was, where you went from, running basically, tackling two major crises, COVID and I guess you were already with the CDC when Mpox came
oh
around in
yeah. I
2022.
mean,
But
I got pulled. I mean, speaking of like imposter syndrome, like I got pulled to the White House. Like, what infection? Like, there's not a lot of infectious disease doctors that get pulled to the White House to run an outbreak. And so, was I like fully confident when I walked in the door at the White House? No, but boy, like I learned how to do it, and it was great.
what were the sort of lessons do you think that we can take away from the whole? Because I obviously remember living in West Hollywood, getting vaccinated, and that whole experience. And you hear occasional rumblings about there being another outbreak,
Yep,
and I think even very recently, I think there was talk of that.
for sure.
But what do you think? Do you think that sort of? I mean, not I guess unless disease or it goes completely, whatever, not extinct. That's not the correct word. But it goes completely dormant.
You
I
can say
guess then
eliminated, maybe.
like eliminated. It could always come back. But
Yeah.
uh, where do you think that that's a imminent possibility, just based on what you've heard anecdotally from your experiences?
Yeah. I mean, so I think definitely, I mean, think about like what's going on with measles. Measles was eliminated in the United States too, right? So if you like lose, if like people are like not getting, either not protecting themselves appropriately, whatever that may mean for them, or not getting vaccinated, then all of a sudden, like you'll have a bigger population of people that could be at risk for Mpox. And that could mean like outbreaks. And so I think that definitely, we're always at risk for a resurgence of Mpox, just because there's always new people who are either not immune because they've had it or not immune because they've not been vaccinated. And so like that's why it's important that drumbeat continues about making sure that folks are up to date on their Mpox vaccine if they're folks that are at risk for getting Mpox. I think we hear about cases here and there. There's a couple different flavors of Mpox. There's the one that we were pretty familiar with during the outbreak in 22 and 23. And then there's another strain that pops up every now and then in travelers that may even be more severe. So, the thing about taking it from Mpox to just in general, like one of the most important things in infectious diseases is having like a huge amount of humility, because like you can never predict really what these viruses are going to do. Like you never know. And every time you like, so whenever you hear someone who has like full confidence about anything in infectious diseases, you need to question them, because there is nothing that we are fully confident about. But we can say like, most likely if you're vaccinated against Mpox, the chances that you'll get the disease are a lot lower. And if you do get the disease, it will be a lot milder.
Right. And these
Otherwise,
things are
like,
ever evolving too, where there's new strains
totally.
and new, right. And so there's no guarantees about anything really, except that you can
No.
do everything you can to put yourself in the best possible, situation.
Yeah. And we
One of
just
the
need to be
before we talk,
humble. We need to be humble. We don't know.
be absolutely. Before I talk to you about sort of the current environment, I wanted to ask you, during your time at the CDC and at the White House, what were some of the things that you were most proud of in terms of bringing certain things for instance, something that stood out to me, which I feel like given that from like 2017 to 2021 or 2022, a lot of these topics in when it comes to LGBTQ plus health, the whole notion of undetectable equals untransmissible. That didn't really, I mean, yes, it existed in 2017 or 2016 during the Obama administration, but for those 4 years, I feel like that whole concept sort of rose to national prominence. And then when we had a president in the White House again who, was willing to sort of allow the government to talk about these topics again, I feel like that notion under your tenure sort of rose to prominence on the national level. But maybe you could talk a little bit about that and some of the other issues that you were proud to are part of bringing to light on the national level.
Yeah, I mean, I think U equals U, undetectable is equal to untransmittable is like a really great sort of example. I mean, I think that, for me, I was the first public health official in the country, maybe the world, that sort of took along a government organization to sign on to say that undetectable is in fact untransmittable. And so like it was almost instant, like what the aftershock was, which is that people were like, well, like that is like potentially like a great tool to address a lot of the stigma around HIV. And so like very quickly it got pulled into like, guidelines even. So if you look at the like national guidelines for HIV treatment, they say like you need to talk to your patients about the idea that undetectable is equal to untransmittable because it means that they are, that they won't transmit infection sexually. And so like it ends up being a pretty liberating moment sort of from the perspective of some of the stigma. Now, with that said, like, it shouldn't have taken U equals U to liberate from stigma. Like it's just, but, unfortunately it did, but like it is a good,
Shocking how much ignorance there still is about that issue.
oh
I
yeah,
mean, yeah, and even living in a city. I mean, granted, I mean, I grew up from a young age with my mom having friends who were HIV positive, and so for me, it was never something that I mean, of course, you're always learning new things, but point being that that whole notion, undetectable equals untransmissible, is something that a lot of people, even within the gay community, still don't understand, or aren't aware of. I mean, there's still a ton of. So I think what you did in sort of, putting that sort of notion into now, not just the culture, but into guidelines around the country and the world, it's kind of a massive, massive accomplishment and achievement.
yeah. I mean, I feel like,
Yeah.
when I got to CDC, like, I mean, interestingly enough, when I landed at CDC, they still hadn't sort of, changed all of their materials to say that undetectable is equal to untransmittable because there was like a little bit of, like hesitance because, nothing is absolute in infectious
Right.
diseases, but it is, it is absolute. Therefore, like we were able to move the needle. I think that the other thing that I'm really proud of was in the Mpox response,
Yep.
which is that like what I did as Mpox started to unfold is I like look back at the history of HIV and try to use like the lessons that we learned at the beginning of the HIV outbreak
Wow.
to sort of try not to make those same mistakes with Mpox. And so like I
Wow.
literally like was like, okay, this is what like, I remember vividly when I was a kid, like there was this whole like HIV is a gay disease, HIV is a gay disease. And I was like, I am never going to say Mpox is a gay disease because Mpox is just a disease.
Right.
There are behaviors that can cause transmission of Mpox. And we need to make sure that people who are engaged in those behaviors are aware of the
Right.
risk. That is a very like enlightened by HIV approach as opposed to the like just making it industrial strength and saying like gay men are at risk for Mpox, period, and that's the end of it. Like, and so it's more nuanced and complicated, but it I think is like one example for me of like the lesson that I learned by living that and sort of seeing the activism and seeing the impact of like words on like stigma that last decades on how important it is to sort of try to like actually learn and implement the lessons that I learned.
It's the
Really
it's
proud
the
of that.
perfect it's the perfect example of how knowing history actually, what do they say? People, I mean, it's a cliche expression, but those who don't know history are doomed to repeat it,
Right.
basically. And so, no, I think that's incredible.
Yeah.
You know,
Oh, I was
uh,
like, I have the opportunity for a redemption story.
yeah,
Like I can be like, I can like say, I can have this conversation with you years out after
yeah,
Mpox and say like, it wasn't perfect, but we learned from those lessons to
yeah.
try to make it better. And it ended up being a little better.
Absolutely. Not, I mean, obviously, you guys, it stopped. I mean, of course, it can always continue, but I mean, in terms of the war path that it was on, it was stopped in its tracks. But then also, I feel like you're right. There wasn't quite so much of a cultural stigma, as there was with HIV, and I remember distinctly seeing the press and seeing, like, this is not a gay disease. This is not a gay, and
It was a lot of work
yeah,
because it's so easy just to say that,
right,
right? It's so easy because then you're done, right? So
yeah,
you can just be like, I've made it clear, like I've communicated in like a sound bite what the
yeah,
problem is, but then what happens is like it's A, not true, and B, it creates like potentially years of stigma afterwards. And so
hmm
anyway, I'm glad that you felt that there was like a difference
I
in
did.
something that felt different.
I remember it. I remember it. Actually remember it being in the moment and hearing it, and it meant a lot. But I wanted to ask you. I don't know how much. I know you have talked about it, but I also don't want to ask you to talk more about it than you feel comfortable with, obviously. But given the change in direction that's taken place at the national level, not just in the White House, but CDC or HHS, but again, you talk about it as much or as little as you want, but what was that whole the end of that tenure like, and also how do you feel about some of these changes that have happened, not just on LGBTQ rights, but obviously measles and lots of different areas in which HHS with Secretary Kennedy has gone in a very different direction.
Yeah, I mean, I think that, when I think of CDC now, like while I was there right before I left, like the best way to describe it to people who aren't there is it feels like a hijacked plane, right? So you have like a lot of scientists, a lot of really excellent public health, people who range from science all the way to administration, who are there trying to do work. And, it's been hijacked by people who are really looking at, using it as a tool for like ideologic purposes, as opposed to like the what it's supposed to do, which is to deliver on its mission to improve the health of America and Americans. So like it feels, for me, I stuck it out for about 8 months, almost nine, because I, felt that, as a civil servant, that I was able to sort of mitigate some of the harms that were coming. But then for me, when I got to the point where, it was clear that in that hijacked plane there was no pilot that had any scientific expertise, and it was driven purely by ideology, and there was like less and less that we were able to do. I felt that that's like when my two O's that I've taken in my life, that I've taken very seriously, are the Hippocratic oath that says first do no harm, and then the oath that I made when I became a civil servant, which is to serve the Constitution. I thought neither of those was I going to be able to sort of deliver on, and so I couldn't stay. I Yeah, I just felt that I was going to just be, that by sort of staying there while people were sort of doing things that were bad for health, but then sort of being the face of that for immunization and respiratory diseases, I was like, I can't really do that, and sort of feel like I'm trusted by the people I'm supposed to serve. I thought it was going to cause harm, and then again, my oath as a civil servant was very clear, and I thought that the sort of more authoritarian stance that was not listening to science and experts, was not going to be something that really reflected what the Constitution wanted me to do as a civil servant. So I had to go.
I know this is kind of a digression, but like, you know, I have, in full disclosure, I have friends or people I know who actually know and are friendly with, or were anyway, with RFK Jr. And I gotta say, aside from a lot of the thing, there are obviously a lot of different things in which I disagreed with him or disagree with him even before he, became HHS secretary. But the thing that I found, I mean, again, there's the vaccines, there's a lot of stuff, but the thing that I remember from when he ran for president that just made me go like, this is, excuse my language, like fucking insane, is when he did, I don't know if you saw, I'm assuming you probably did see this clip, of him from, I think it was 5 or 6 years ago, where someone who is, says they're steeped in, scientific knowledge and when he made that claim that, he remembers anecdotally in the early 80s how, gay men who did a lot of poppers were getting AIDS. And I was just like, that, I mean, okay, there was a lot of other things that were deal breakers, but that was the one where I was like,
Yeah.
I
In,
just,
in general, it's weird to have a Secretary of Health who doesn't believe in germ theory.
right. Yeah.
Like is there some ether or some miasma that's causing the illness when we actually have like very clear scientific evidence that the cause is a virus? And so I think, I
The fact
can't
that
see.
AIDS denialism still exists, or HIV denialism still exists. I mean, I know it's been sort of debunked in a lot of ways, especially because a lot of the people, not to be glib about it, but a lot of the people who advocated for it are dead, But the fact that that still is a thing and now that the Secretary of Health and Human Services has advocated or is just kind of
I
scary,
mean, there's a
pretty
theme,
scary.
right? There's a theme of like very sort of anecdotal, in my experience. I mean, like the
Mhm.
entire drug policy so forget infectious diseases, like the entire like drug policy for the United States is now based on the feels from RFK, right? Like that's the bottom line. It's like this is like he'll share what his voyage was, and then all of a sudden the entire thing is based on his voyage, which is that of a very, very well resourced white man in Massachusetts, which is a lot different than like the child in the Bronx that has a completely different experience. And so I like to base things on epidemiology and data. They like to base things on feels, and so we are living in a universe where feels are coming from the Secretary of Health that are influencing policy, and that's going to mean potentially not so great outcomes for people that aren't from his experience.
I mean, I'm sorry that that sort of experience ended the way it did, but I'm also admire you, tremendously, both for that, for your taking a principled stand in that moment, but also, as I mentioned earlier, just your entire sort of lifetime so far of incredible purpose-driven work. I mean, given that, that continues to be your North Star, what are you focused on now, and what are the ways that you think that you anticipate that you might continue to give back in the future?
Yeah, I mean, so I've kind of gone back to my roots. So I'm currently working at like a great community health center in New York City called Callen-Lorde. It's the like really like the preeminent LGBTQ serving community health center in the country. And so it's like, all the things that I helped design, now I'm like on the ground implementing. And so I'm kind of this like full circle experience back to New York and back to sort of the front line, but then also staying connected to the national scene and making sure that like, the part about leaving government is that now I'm an advocate again. And like that is like both a lot of responsibility, but then also I think a lot of liberty to be able to sort of be more sort of clear about what needs are not being met and all of that. So I feel like I'm not sure what the future holds like long term, but I think that right now it feels really good to be somewhere where I'm like making good on the vision that I held for the country as we moved into like the sort of strategy for helping to end the HIV epidemic.
Yeah, what a time to be involved
Yeah.
in that mission. It's like we could be almost there. I mean, depending on what the federal government does to try to either help or veer us off course, but it feels like that goal is in our sights,
You got to
right?
keep the North Star. So
Yeah.
even when my dumb story is like when they asked me to be the head of the immunization and respiratory disease center, I was like, this is great. If I can figure out how like the vaccine infrastructure works, when the time comes for an HIV vaccine, I'm going to be able to actually figure out how to make it happen, like how to implement it in the world. And so like it's just keeping that North Star no matter where you land, because it's like the thing that sort of, makes waking up in the morning exciting. And that makes me
Yep.
feel like every day I go to work and it feels like I'm playing rather than working, which is how it should feel.
Absolutely. Well, thank you. Seriously, I know it sounds
Pleasure.
perhaps, but trite or whatever. But I mean it from the bottom of my heart. Thank you. You're an incredible public servant, and
Thanks, Duke.
thank you for, on a personal level, and on behalf of our community. Thank you for all
Thank
the
you.
work that you do. It means
It
a
was
lot.
great to talk to you. Thank you so much.
Great to talk to you. Thank you, everybody, for joining us for this episode of Duke's Download with Dr. Demetre Daskalakis. Truly an exemplary public servant and such a nice guy, and so many important lessons that I think we can take away from somebody who has lived a life of true, effective public service and advocacy. Please like, share, subscribe. If you have any questions, feel free to email us at questions@dukesdownload.com. And I will see you next week with another super cool, super interesting special guest. So thank you for joining us. See you soon. Thank you for joining me today on Duke's Download. This podcast is part of Pride House Media, hosted by me, Duke Mason, and produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and review. It really helps others to discover the show. I'd love to stay connected with you, so join the conversation by following me at James Duke Mason on Instagram and X, or by emailing me at questions@dukesdownload.com.